as Bailey said, I'm here to talk a little bit about door-to-call center times. First of all, I have nothing to disclose, no financial interest in the program. And when we're looking at door-to-call center times, it's important to understand how they play into the overall performance of our program. So it's important to know how we're supposed to perform, and then we need to know how we actually do perform, and then what steps we can take to get better. So looking at how we're supposed to perform, American Heart Association, American Stroke Association implemented a nationwide quality improvement initiative in 2010 called Target Stroke. In Target Stroke, currently we're in phase 3 of that. It started in 2019, and the goals for 2019 phase 3 are 85% of our door-to-needle times should be in 60 minutes or less. Of those, 75% should be in 45 minutes or less. And of those, 50% should be in 30 minutes or less. So these are the goals for facilities that have in-house neurology. Now, telestroke is a little bit different with a lot of moving parts. So the goal for telestroke is door-to-needle times, 50% of the time need to be 60 minutes or less. So this is how we're supposed to perform. So how do we perform? Well, I'm happy to report that in 2020, the IDHI stroke program, 51% of our door-to-needle times were in 60 minutes or less. So we did it. You guys pat yourself on the back for a job well done. So this means we have met our goal. We met our goal. Now, look what we've accomplished. So no longer are we number 1 in the nation for stroke mortality. Arkansas is now number 13 in the nation for stroke mortality. This is a result of a lot of hard work and a lot of effort from a whole lot of people. So we've met our goal. We've moved the needle on our national mortality ranking. So are we there yet? That's the question with every journey is, are we there yet? And the answer as it pertains to stroke is no, we absolutely are not there yet. Because no matter what our national mortality rank, nothing will ever change the fact that 32,000 brain cells still die every second that someone is having a stroke. So we can be number 50 in the nation for stroke mortality. That's not going to change how fast brain cells die when somebody's having a stroke. Time lost will always be brain loss, so it is important for us to realize that our job is never done. We've always got to work to meet our goals, and more importantly, we need to exceed our goals. So how do we do that? How do we exceed our goal? Well, currently we're meeting our goal, but in order to exceed our goal, we need to focus on door-to-call center times because this is our biggest opportunity for improvement when it comes to overall door-to-needle times. Looking at this slide here, I'm going to try to talk my way through this one. If you look, this shows our program performance trends from 2014 to 2020. And you can look in the far right-hand column on the slide and see the goal times. Looking across the top row on the door-to-MD times, you can see that we have consistently, easily exceeded that 10-minute goal time. The same thing with door-to-CT times. Since 2014 all the way up to 2020, we have consistently exceeded our 15-minute goal time. Now, look what happens when we get to door-to-call center. Looking all the way from 2014 to 2020, we have never met our door-to-call center time of 25 minutes. And so another thing that I want to point out on this slide, if you look at the bottom row across left to right, our door-to-needle times, if you look consistently from 2014 all the way up to 2018, we had steady improvement, very steady improvement every year in door-to-needle times. But look, 2018, 2019, and 2020, you see we kind of reach our goal and we stay there. We've sat meeting our goal for the past 3 years. And so now the door-to-call center time is the one thing that's going to propel us beyond meeting our goal and get us into exceeding our goal. So looking at what does it take to treat a patient in quicker times. What I've done here is compiled all of our consults from 2020 that had a 31 to 45 minute door-to-needle time. And you can see the median time for door-to-call center is 13 minutes on those calls. And I've also put out to the right, in the right-hand column there, our 2020 median for door-to-call center was 30 minutes. And this 30-minute median is what helped us achieve our goal of 60 minutes on the door-to-needle time. So you can see the door-to-call center time of 13 minutes helped us achieve a median door-to-needle time in this group of consults for 40 minutes. And the same thing, just for kicks, let's look at what it takes to treat a patient in 30 minutes or less. So the same thing here, we had a few less of the 30-minute door-to-needle times, so I've compiled all of our door-to-needle times from 2017 to 2020 to come up at a median door-to-call center time of 8 minutes in that group of calls. So 30 minutes or less, the median times for door-to-call center was 8 minutes. And again, compare that to our 2020 median of 30 minutes on door-to-call center time. So you can see where our opportunity for improvement is. It's purely in the door-to-call center time. So just to compare, looking at, this is side-by-side comparison, for a 30-minute or less door-to-call center or door-to-needle time, we need an 8-minute door-to-call center time. For a 31 to 45 minute door-to-needle time, we need a median door-to-call center time of about 13 minutes. So this is our opportunity for improvement, like I said. With that, now that we know where our opportunity to improve is, I would love to issue a very intentional, very purposeful challenge for the year of 2022. We all know that when we stay in our comfort zone, we don't grow much. And over the past 3 years, we can see that we're kind of sitting right at meeting our goal. And now it's time for us to work very intentionally to exceed that goal and improve our patients' outcomes even more. So we're all going to need to get out of our comfort zone and very intentionally work to improve our door-to-call center times in 2022. So what is our challenge? Our challenge is door-to-call center time in 20 minutes or less. You're all used to us saying we need to be calling the call center in 25 minutes or less. So what we would love to see for the year 2022, when that year is ended, we would love to see that our median door-to-call center time was 20 minutes or less. If we see that, we're going to see a big improvement in our overall door-to-needle times. So we'll start this challenge now. It's never too early to get started on this, but officially it will start July the 1st, 2021, and we will complete it June the 30th, 2022. So it is doable, it matters, and yes, we absolutely can do it. Okay, so you probably remember back last month we requested that you fill out an online survey identifying your biggest barriers to calling the call center sooner. So this slide shows the overall results of that survey, and the biggest barriers that were pointed out were nurses don't feel comfortable initiating the nurse-driven protocol. Staff is not confident in the workflow of the stroke consult. Staff receives pushback or mixed messages when calling the call center. And one of the biggest indicator here was other. So a lot of people had other things that were not listed. So the next slide, we're going to look at what some of those others were. Nurses want to have all of the information and everything done before they call the call center and get in front of the neurologist. We have busy departments. No other nurses are available to help. Many nurses don't feel comfortable getting away from the ED with their patient to go down for that CT. They're nervous that something may happen while they're gone and away from the ED. Many new nurses are employed. This is something that we all see a whole lot lately. We have a lot of new nurses joining our workforces, and they're not comfortable with the consult, the workflow. When ERs are full, sometimes we have to pull nurses from the floor or other units to come down and help in the ED, and this takes time as well, causing some delays. We also asked you to give us some feedback on what you have done to improve your door-to-call center times. And we very much appreciate the information we got on there. This is kind of a summary of the information that we received from you. Physician education and updates was a big one. You guys mentioned a whole lot that it's very important to keep your physicians updated. Make sure that they know about those consult scores and that they know how important time performance is, and that we are, the more time that we save on treating these patients, the better our patients' outcomes are going to be. You pointed out that you meet EMS at the door and use their blood that they draw en route if you're able. If your facility does enable you to use the blood that EMS draws, by all means, send that to the lab and get those results back stat. You mentioned that it is important to educate your nurses on the importance of calling while the patient's in CT. A couple of things, the next two actually, the overall take on those is that we're having another nurse initiate the consult while the patient's down in CT. So one said that the charge nurse makes the call, and another said that we have another RN call the call center and initiate the consult, and then get busy getting the room ready while the patient's in CT. We all work together to achieve our goals. And we work hard with EMS PI to improve our processes there. And Pulsera communication was a big one that was mentioned frequently. You guys are loving the Pulsera. And another suggestion is having a very competitive group of nurses. That's probably the most important way that you can improve your overall door-to-needle times, is have that competitive group of nurses. Healthy competition among nurses is always going to equate to better outcomes for our patients. More mocks and continual education is also very important. A lot of our facilities are doing 5 or more mocks a month, and that always shows up in their live performance. So this is the information that we got back from you on the survey, and we've already started working on some resources to help with some of these barriers. What we have done is created a PreConsult checklist. And you can see on this PreConsult checklist, just on the slide form, it outlines what needs to be done immediately. What do we need to focus on first? And then what needs to be done in the next 10 minutes or so to get ready for the consult. So everything that we need to do to get ready for the consult is right here. And it provides some clarity on consents. You can see video conferencing consent. This can be verbal. We can get those papers signed later. Anything that we can do to save time initiating the consult is what we want to do. So I think that many nurses will be very validated in their concerns. They'll feel their concerns are a little bit relieved by seeing this, and it validates what they think they should be able to do, and they may not feel confident being able to do that. So you see in the next 10 minutes, we want to get the blood drawn. We want the physician to evaluate the patient. We're going to review the exclusion criteria. We're going to gather our safety pin, our language cards, all of the things that we need to do, and nothing extra is on the consult checklist. Another resource that we have prepared is what documents need to be in the paperwork packets. I know most everybody creates a paperwork packet so that when a potential stroke patient comes in, your nurse can grab this this paperwork packet, and everything that they need is in that packet. So what needs to be in this packet? Well, your consult checklist. That's a very useful tool. Your intake sheet, your exclusion to call criteria, Altiplace administration orders, your 3 consents, that's the video conferencing consent, your Altiplace consent, and your Altiplace off-label use consent. Transfer orders need to be in there because those transfer orders ought to be they ought to leave with every patient that gets transferred out. So these are just a few resources that we have already worked on to remedy some of the barriers to calling the call center sooner, and we would appreciate any feedback that you have on resources that would be helpful for you. So my contact information is on this slide. Also, feel free to reach out to your outreach nurse if you have ideas. We have a training committee that will be getting together soon to start working on other training resources that may be helpful in speeding up your door-to-call center times as well. Thank you.